Good morning, and thank you for joining us for this presentation this morning, part of Kerby Centre's Spring into 2021, a week-long series of presentations by some of Calgary's leading providers of information and services to help you live your best lives. Before we begin, as we gather here today, it's vital we also remember the peoples who've gathered here for millennia. This is the Treaty 7 land of the Indigenous peoples of Southern Alberta, the Blackfoot Nations of 𝗪𝐶𝐸𝐺𝐫, 𝗃𝐿𝐴𝐺𝐺𝐿𝐴𝐺𝐺, the Tsuut'ina First Nation, the Stoney Nakoda Nations of 𝗺iƙi, 𝗺arspaw, and 𝗺wesley, and the historic home of the Northwest Métis and Métis Nation of Alberta Region 3. It is with the goal of reconciliation that we acknowledge the land on which we gather, and we thank the elders of these nations for their timeless contributions to this land. And as I mentioned, we have an exciting week planned for you, and to help you spring into 2021. All week long, we've been presenting a wide range of topics of interest that will help you maintain a healthy and rewarding lifestyle. This morning, we're pleased to feature Audiology Innovations and welcome Dr. Carrie Scarff. Dr. Scarff is a registered audiologist, PhD, and completed her Master of Science in Audiology at Dalhousie University, Clinical Audiology Internships at Georgetown Medical Center in Washington, D.C., the 𝗍 Grace Hospital in Halifax, and her PhD and postdoc in Auditory Behavioral Science at the University of Calgary in the area of brain plasticity and hearing research. She has publications in the areas of early identification of hearing loss and auditory cortical plasticity following hearing loss with her colleagues at the University of Calgary and Dalhousie University. Dr. Scarff currently practices at and manages her multi-site clinics, Audiology Innovations Limited, in the Mission, Glenbrook, and Mount Royal areas of Calgary with her colleagues. Her clinics also offer mobile clinical care for patients with mobility issues. She is a long-standing board of director with the Deaf and Hear Alberta nonprofit organization in Calgary, and is often invited to educate and inform agencies, the general public, and the government about hearing loss issues, new research, and treatments. She takes a particular interest in brain plasticity and advancements in hearing loss treatment. She and her colleagues provide the latest advancements in research and technology to treat hearing loss. Dr. Scarff, how do we know when it's time to take action on our hearing loss?
Thanks very much, Colleen, for the lovely and warm introduction. And I just want to thank also the Kerby Centre for putting on these wonderful seminars that are just such a great resource for individuals in the community, not just about the education, but also, you know, it links us up and makes us a bit more interactive and with our connections with people and things that are going on in our communities, which we know right now is so important. So yes, how do we know when it's time to take action on your hearing loss? I'm going to get into that today, as well as talk about some really exciting research that pertains to early treatment and better success. Great. So today's learning objectives are a few multifold: updates about hearing loss in Canada, research, the really exciting human trial research in hair cell regrowth, what it means for people with hearing loss, and also treatments and advancements in devices and other new treatments that are very exciting. And finally, of course, I will answer when to take action if you think you might have hearing loss. So this is who we are. This is what we do. I lead a wonderful team of clinicians and employees who really care about people who have hearing loss. We're really at the leading edge, like Colleen referenced in my bio, of taking what is known in science, what has evidence, and implementing that into the clinic with our patients that we see every single day. So as you can see, we have some clinicians from all over the world, from South Africa, from Brazil, from a new student from Bermuda who just started with us the other day. And I think that they're attracted to us. We call ourselves the UN of audiology care, because we are doing such interesting and innovative things, and we make it fun and exciting and successful in terms of treating your hearing loss. So why do we do what we do? Well, me personally, I actually grew up with hearing loss in my family. So I understand the challenges. This is a picture of my son. He's showing the early signs of hearing loss that I myself have, that also my aunt has, who is a very close member of my family to me. And so I think probably because of that personal connection, I started to get involved in audiology, not only in the science of it and the training of it, but in the helping side, in providing care to people who live with hearing loss every day, because that's what me and my family have been doing for a long period of time. And why is hearing loss important? Why is hearing important? Well, hearing loss is a lot more common than most people think. It's also often preventable. Often a lot of hearing loss types, and certainly the severity of how much hearing loss we have, is preventable. So it's very important to be aware of it. And you know, why is it important to us as human beings? Sound is so important. It adds to the richness of our experiences in our life. We know, certainly, we've felt deeply the divide from interactions with people in person, because we aren't in person and we're not communicating as much with them. And this is, you know, this is challenging. So sound is really, really important. One of the things we like to do every time that we open a new clinic is ask our team members what some of their favorite sounds are. And some of the ones that are in one of our clinics, it's called Glenbrook, are on the wall there. And we put them on the wall because it just goes to show that everyone has a different connection with sound. Everyone loves different types of sounds. One of my favorite sounds was when I had a puppy a couple of years ago, and the sound of him sighing is one of my very favorite sounds. Some of our team members said the tuning of an orchestra is one of the sounds that really has emotional connections for them. Other people said dog running. And one that was really interesting was the quiet on a winter day on a walk in the snow. So sometimes the absence of sound can also be beautiful as well. So I mentioned that hearing loss is probably more common than most of you might think. And there's some statistics, some pretty recent statistics to back that up. So in 2012, 2013, the Canadian Health Measures Study did some aging research, and they looked to see what happens to humans across Canada as we age, what happens to their eyes, what happens to their ears, what happens to all different parts of our bodies. And they looked at adults throughout our lifespan. And what they found was that, surprisingly, 20%, or 1 in 5 adults aged 19 to 79 had enough hearing loss to affect their ability to hear speech properly. So that was quite surprising. If you think about, you know, you probably know 10 people in your close group of friends, and that would be, well, that would be 2 out of those people would have enough hearing loss that it would affect their ability to hear speech correctly. So much more common than most people think. What was even more interesting is that by age 60, almost half of Canadians had enough hearing loss to affect their ability to hear speech correctly. Now, so this isn't to say that you can't hear anything, obviously. It's that you aren't necessarily hearing and understanding speech correctly and accurately in different situations. So interestingly enough, they didn't even include people in the over 80 category. So we probably would have had even higher results if we had looked at that. And why is it important that me and other people like me educate the general public and healthcare professionals about hearing loss? It's because these statistics are so high. Many Canadians have hearing loss. Many North Americans have hearing loss. Many people throughout the world have hearing loss. But probably the most interesting part of the research that came out with the Canadian Health Measures Study is that nearly 70% of those people who were shown on the tests to have hearing loss were unaware of their hearing loss. So why is this? There's a few really good reasons for this. One has to do with the fact that generally hearing loss is gradual in nature. I'm going to show you some pictures in a moment of how hearing loss occurs in most people. And it is really a gradual process. It's not usually sudden where you would wake up one day and not have your hearing. It's every day, it just deteriorates little by little. So of course it's harder for you to notice your hearing loss. It's often our spouse or the people around us, our kids, family members, close friends who notice it more than we do. And of course, why it's important that we share this information is because there are so many people in Canada who are aging. In 2016, it was the first time, based on our Canadian census, that the census showed there are more people in the over 65 category than in the under 14 category for the first time. So what does that tell us? It tells us that every year our population is growing older and older. And based on the hearing loss statistics, that means more and more Canadians will have hearing loss over time. So if there are more people with hearing loss and the majority of them aren't aware of it, and we know, I'll show you in a minute, that there are detrimental effects of hearing loss if we don't do anything about it, then it stands to reason that we need to really educate people about why hearing loss is so important. So, like I mentioned, people are not generally aware of their hearing loss. 70% of them are not aware of their hearing loss if it's been gradual in nature. Some other interesting research is that people tend to wait about 7 to 10 years once they identify that they have a little bit of hearing loss before they actually take action and do something about it. And that is not healthy for our brain. So we're going to talk about why that is in a moment. There are also multiple health-related challenges that can occur if we have hearing loss and don't do anything about it. Some of these things include risks of falls, increased rate of depression, and increased risk of dementia, for example. So those are pretty serious health-related links with hearing loss if we don't do anything about it. On the other side of the coin, on the flip side, if we have cardiovascular disease, so people who've had a heart attack, people who smoke are at higher risk of hearing loss. If we have diabetes type 1, because of course, changes occur to the blood relationship with other factors in the blood going to the ears and different parts of the brain, that changes our ears as well and puts us at higher risk for hearing loss. And then certain cancer treatments that are ototoxic can damage the ear and put us at higher risk of hearing loss. So as you can see, hearing loss is closely linked with other health, very important health-related diseases. So we have to be aware of the whole picture when people come in to see us and ensure that we're providing them with correct information to make sure that their overall health is good. Here's probably the most important and the most interesting of the research that people ask me about after I do these presentations. So this is to do with the fact that if you or a loved one has hearing loss that is what we call untreated, so they have hearing loss, they haven't done anything about it, they're living with that hearing loss. What the Lancet showed in 2017, so they put together a Dementia Commission's paper, and they looked at all the research throughout reputable institutions throughout the world. And they filtered through the research and put out a publication showing the highest risk factors for dementia. And what they found was that in the group of people over age 50, hearing loss was the highest modifiable risk factor for dementia. It was surprising to many people in the scientific community. It wasn't as surprising to people in the auditory science community, but it gained a lot of press because it was unexpected. So that was the first bit of research that came out. There were other modifiable risk factors that they discussed, obviously things like social isolation, inactivity, poor nutrition, etc. But hearing loss was the top modifiable risk factor for dementia. What was interesting was that in 2020, they revisited their research and their publication and they updated it. They said that there was enough updated research that they needed to add a few of the risk factors to their publication. They found that air pollution and head injuries were 2 additional risk factors for dementia, but they reconfirmed that hearing loss is still the highest modifiable risk factor for dementia. So just another reminder how important it is that we need to address hearing loss if there is a problem. And what they also said, which was very interesting, is that there's enough research now as of the fall of 2020 to show and say that hearing aids reduce the cognitive changes and the associated risk for dementia if a person has hearing loss that could benefit from hearing aids. So that was pretty big research in the world of auditory science. This research didn't hit the media as in such a large way as the first research, probably because of where we are in the world with so many other health concerns going on with COVID, etc. So the question is, and a lot of you are probably asking, well, why are adults with hearing loss more likely to develop dementia? What is the reason for that? So there are three main theories, three main reasons, and I believe that they actually work together in combination with one another. So one is actual physical brain changes. So this is based on research from Johns Hopkins Medical Center from Dr. Frank Lin and his colleagues. And since 2012, we've known from their research that the brain and the cells of the brain actually physically atrophy or shrink if they don't receive the proper stimulation. So that was the first time that we were able to see that. That was with functional imaging, functional MRIs that we showed. After 4.5 years of hearing loss, if people don't do anything about it, there's actual physical structural changes at the brain. So that's reason number one. The brain actually shrinks. Number two, social isolation. So we've all experienced this in the last 14, 15 months. Obviously we've experienced it due to COVID, but even before that, if people have hearing loss and they don't feel that confident about interacting with people when there's maybe more than one person in front of them. So maybe they're having a dinner out at a restaurant, or maybe they're at the golf club after golfing and having a beer with some friends. If they start to experience situations where they don't quite understand what's being said, and there are consequent miscommunications where someone asks a question and we reply incorrectly, we start to lose our confidence, and people withdraw from participating in those kinds of activities. So they start to become more socially isolated. They don't have as many communication partners. They don't have as many opportunities to interact with people verbally. So social isolation. And we know from the 1990s and even before that social isolation leads to permanent detrimental brain changes. The third factor as to why untreated hearing loss leads to a higher risk of dementia is very interesting. It's more of a recent theory, and there has been research to support this as well. And it has to do with the fact that if you have to work extra hard to listen and to hear, so think about, if you're at a noisy place, if you have to strain, if you're at a social function and you'll notice that you're probably quite fatigued or quite tired at the end of that function. So not only are you tired, but your brain has been working overtime and it's using more than its share of energy to help you hear, whereas it should have been using that energy for other things, perhaps for your memory, your vocabulary, or for decision making, amongst other things. So those are the three top reasons why we believe that adults with hearing loss are more likely to develop dementia, particularly if we don't provide treatment to the hearing loss. Okay, so why do we develop hearing loss? This just is a brief overview of what generally happens in our ears. So sound normally travels down the ear canal, it vibrates that eardrum, and the tiny little bones or ossicles deep in the middle ear, those are the tiniest bones in the body. They're just a few millimeters in size and diameter. Those little bones send a message. They bounce against the cochlea, and the fluid in the cochlea bends the little hair cells. There's an example of what they look like in the picture below. Those hair cells move back and forth, sending a message through the nerve up to the brain. That's what we see when things are working properly. In 90% of the cases that we see, which is people who have hearing loss from natural life, from natural age, it's those tiny little hair cells that wear down over time. Of course, there are other reasons that people can have hearing loss. For example, if the bones start to solidify and don't move the sound properly, if you have a hole in your eardrum, for example, or if you have an ear infection, but those are different types of hearing loss, and those are much less common and often quite treatable medically. So the hearing loss that I see and people, audiologists like myself, see who have permanent hearing loss, it's generally due to these hair cells that have deteriorated over time. So just keep that in mind as we move to the next slides. So here's a picture, if you look at the top image, of hair cells that look relatively intact and healthy, and those would be in the inner ear. And then the ones at the bottom, look like they've worn out, and some of them are missing. So of course they can't send the proper message up to the brain through the nerve if they're missing or if they're deteriorated. So here's the very, very exciting part of research that came out in the last 2 months, is that we can now, in humans for the very first time in the world, regrow and regenerate hair cells in that inner ear. So there's a picture again here of the inner ear. You'll see this little blue blob that basically delivers some different molecules to the inner ear through the opening to the inner ear. And a company called 𝗵𝗄𝐺𝐵 Therapeutics out of the United States has been looking at this and testing this in humans for the first time. And like I say, for the first time, because before this, we only tested this type of strategy in different manners, but basically the intent was to regrow those hair cells in different types of animal systems. So this is the first time ever it's been done in humans, and they published the results in March of 2021. How does it work? Basically, what they're doing is using cells that are already there. They're basically stem cells that they can make work in a different way. And they, instead of growing these little pillar cells that they're called, that are purple at the bottom, they get these particular cells to grow little hair cells. And they've been able to do that in humans. And not only that, they've been able to show that with this medication, there were 4 participants who showed an improvement in their understanding of speech and in the amount of hair cells that were shown in the very high frequencies. So first time in the world, good results, word discrimination was improved. However, sadly, the next research study that came out within the following 3 weeks showed that there was no difference between the control group and the group that was provided with the medication treatment. So the results are yet to be seen. They're doing a number of large-scale studies on people with different types and different severities of hearing loss. However, they have definitely proven the concept that there's potential for regrowth of those hair cells. I've watched this research area for a number of years. We've always been talking about, when we regrow the hair cells, will this, fix hearing loss in people? And we always thought, well, when that happens, that's the goal, is to fix hearing loss in people. And what we're seeing now is that it's a much more comprehensive and complex strategy than that. Yes, we can probably regrow some hair cells. It's probably going to happen in the very, very highest frequency ranges. So it might help people in part of their hearing loss area, but we might still need to look at technology to help them with the other parts of their hearing loss. So I can see a world where in the future, people might, it's kind of like when I had my laser eye surgery, I was so excited because I could certainly put on glasses and see things throughout the day, but in the morning when I would wake up and I couldn't see my alarm clock and I couldn't tell what time it was, my natural eyesight was still poor. But so I could see, now that I have my laser eye surgery done, I can read my phone, I can see my alarm clock and see what time it is. So I can see a similar world in comparison with the hearing world, where maybe when we're sleeping at night, we have a little bit better awareness of sounds around us. And then in the daytime, when we want to hear everything as accurately as possible, we still use technology to help us with that. So the potential for this regrowth of these hair cells, it just absolutely highlights and underlines and circles the importance of preserving our auditory function at our brain with every possible manner that we can over our lifespan. Because if we don't, then we could certainly regrow the hair cells. But if the cells at the brain aren't in the proper shape to handle information, then all is lost. So if you have hearing loss, you must keep your auditory system properly stimulated. I can't highlight this enough. With where we are in science, it would be just absolutely unfeasible in my mind to not think about keeping that receiver at the brain, the auditory system, properly stimulated, so that we have the capacity to take advantage of these scientific advancements in the future. So that's my mission on where science is, where things are going, and my mission is to make sure that people know that so that they take the proper steps to preserve their auditory function. So what are the proper steps for that? So you have to start with ensuring you're receiving thorough care. The audiogram is really a starting point. So there's a picture of a couple graphs over there, and honestly, you know, that's only the starting point. It's a screening. It tells us how you hear beeps. We don't walk around in the world listening to tones, listening to beeps. This tells us very little about how well you hear in the real world, in places where there's more than one person talking, in places where there's noise, or simply even listening to people talking and understanding words and conversation. So for those kinds of assessments, we have to look beyond these graphs. Think of these graphs as a starting point. Further investigation, further testing is crucial if we want to make sure that you are receiving thorough care. So the most important parts of tests will tell us how well you hear and how well you understand what you hear. So we do speech testing at our clinic to see how loud words have to be for you to understand them correctly. We also have to go beyond testing people in quiet. If you go to 95% of clinics in North America, audiology clinics, and you get a hearing test, you're going to get a test that tests you in a soundproof room. That's the room that I'm in right now. Well, think about the reason that you went to get your hearing test. Probably, this is what I see every single day. Most patients say the hardest environment for them to hear in is a noisy place. So if we're testing them in a soundproof room, how are we doing them a service of evaluating them accurately? We're really not. So researchers in Australia several years ago now, I mean, this is not brand new, this is 8-10 years ago, they came up with a number of different studies of ways for us to test how well you can hear when there's noise. So that's one of the tests that we believe is critical for us to really understand how well you function with your hearing loss in the real world. And so we do a listening and noise test. And like I said, most patients report this challenge at listening and noise as one of their first symptoms of hearing loss. So wherever you go for your testing, investigate and make sure that they're going to do a listening and noise test. Okay, so when is it time to take action on your hearing loss? We know that almost half, 48% of Canadians over the age of 60 have difficulty hearing speech correctly, almost half. How will you experience this? How will you know that this is the case? It's usually high frequencies. Those little hair cells that are responsible for the high frequencies wear out first. So here's what happens. The first signs are that you will feel like you can hear, but not understand. And that pertains to the little graph in the top left-hand corner. So if you look at the dark blue part of the graph, that's the part of the graph that you're not hearing properly. Okay, when you have a high frequency hearing loss, a very common looking graph for someone who might be age 60, age 65, age 70. You can see that the part you're not hearing is cutting out some of that little bubble that says consonants. Okay, consonants are critical as humans for us as communicators to understand what we hear and to feel like sounds are clear. So if you feel like you can hear, but not quite understand what's being said, and you feel like there's a loss of clarity or like people mumble or are muffled, that's one of the very first signs that you've got some hearing loss. Secondly, I would say if you feel tired because you have to strain or you have to work harder to hear in different situations, then that could be another reason that you should get at least investigated and have a hearing evaluation. So here are the most common symptoms, signs and symptoms of hearing loss. The slide previous was kind of just to describe how you'll feel overall. These are signs and symptoms, and I like people to look at it like a checklist. And if you experience 2 or more of these frequently, then it makes sense to investigate your hearing with an audiologist. So asking people to repeat frequently. Okay, so it's not like asking a person to repeat once in a while when you're not paying attention. But if these things happen frequently, this is an alert to you that you should get investigated. Turning up the TV or radio or iPad louder than the other people around you. Remember, I said that usually your hearing loss is gradual. You don't notice that you're doing those things, turning things up, but maybe your kids do. Maybe your spouse does. Okay, so listen to them when they tell you these things. Difficulty hearing people if they have their back turned. Of course, if we're not facing each other, all of the energy from my mouth will go in a different direction. So there's not as much energy coming to your ears. And if you have a hearing loss, then you need as much energy from that person's voice as possible to help compensate for your hearing loss. As I mentioned in the previous slide, feeling like people mumble or are muffled or aren't clear, okay? That is one of the top signs or symptoms of hearing loss. Difficulty in background noise. Probably the most common sign or symptom of hearing loss, one of the ones that pops up first. Why is that? Well, if you've got some hearing loss and you aren't really used to it, you don't realize, but your brain is kind of out there searching for all sorts of information to help you understand what people are saying and what you're hearing. When you go into a noisy place and there's a lot of background sounds, the brain gets overstimulated by those background sounds, and it's almost, think of it like a blanket on the sound that you want to hear. So the sound that you want to hear coming to your ears isn't coming in as a clean signal, and your ears are incapable of picking up things as they used to. So it's a real communication breakdown. Tinnitus, ringing or buzzing in the ears or in the head. So when we have hearing loss, the ears can't send as much information up to the brain as they used to. We hear with our ears, but we listen and understand with our brain. So if the brain is not getting as much information as it used to, it doesn't like that. It wants to keep those cells active, so they spontaneously fire. And you will hear that as ringing, buzzing, humming. Some people hear it as music, all different sounds, but they're not real sounds in the environment. They're created in your own body. And then here's some new COVID symptoms to consider. I have a lot of patients in the last year or so saying, you know, mostly with people wearing masks, I cannot hear as well as I used to. So just think about the visual cues that are hidden if you can't see someone speaking. So the mask wearing is really impacting people's ability to compensate for their hearing loss. Maybe they didn't even know they had hearing loss, or maybe they knew they had a little bit of hearing loss, but now that the masks are there and they can't rely on what they see people saying, it's called lip reading, it's more noticeable that they have hearing loss. So again, these are some signs and symptoms of hearing loss. I know that the Kerby Centre is they're recording this, they're going to put it on their YouTube channel. So this is a really good slide for you to take a look at to determine if you should at least go in for a thorough hearing evaluation. Okay, so what can we do if we are experiencing some of these challenges, or if someone we care about is experiencing these challenges? Because of course, based on the research, it is clear if someone has hearing loss and doesn't do anything about it, there are permanent detrimental effects that can happen to our brain. So we need to be aware of these things. There are lots of technology advancements, okay? So when I use the word technology, what I mean is hearing aids, what I mean is microphones, what I mean is there's implantable hearing aids, rechargeable hearing aids for people who are deaf on one side, and there's a microphone that picks up sound from their deaf ear. All of these devices, many of them are now Bluetooth compatible, water resistant, you name it. There's all sorts of devices out there. But I guess before we go into some of the really exciting improvements in devices, I want to share with you that technology and devices are one part of your hearing care solution. If you have hearing loss, we need to understand the sounds that are hard for you to hear. We need to understand your listening environments. We need to understand your communication partners. We need to understand where you want to hear better, because hearing aids might be one part of the solution, but there may be some other parts that can assist you in equal measure as hearing aids. And it might be something as simple as actually bringing your spouse in and teaching them to get your attention before they speak to you. So teaching them some communication habits that will help you hear them better. Or it may be as simple as getting a device like a microphone that I'm going to show you here that your spouse can wear when you guys are driving in the car to the mountains on the weekend, so that, let's say they're the driver and maybe they're the one who has hearing loss and they can't keep looking at you to try to understand what you're saying. So you could wear a little microphone that sends your voice directly into their hearing aids. So there are a number of different solutions to hearing challenges, but we really need to investigate what your hearing needs are before we give you a solution. We can't put the cart before the horse. So I think that's really important to understand. Getting back to the microphones, these have really advanced significantly. This is one of the biggest advancements in the hearing care industry in the last 5-7 years, because they're microphones that the person you're talking to can speak into, or you can put on a table at a restaurant, and they're very powerful and they're directional, and they can pick up the voice that's speaking and send it directly into your ears through your hearing aids. They're great for board meetings, they're great for restaurants, great for cars, great for all sorts of situations. So that's one of the biggest advancements in our field in the last, I'd say, 7 years. Now, here are some other really important things that you can do that are very inexpensive and useful. There are apps that convert speech to text. So if you have your phone, I'll just grab mine. You download an app. There's an app, one example is called the 𝗱𝗶 live captioning app. So you download your app, and then if you're maybe at a coffee shop and you're having trouble, you know that you're going to have trouble hearing the person asking your order because there's lots of noise, there's plexiglass, and they're wearing a mask. You can open up your app, point your phone at the person talking, and it will transcribe what they say into text on your phone. So that's a really convenient way to solve those challenges with masks and plexiglass and those types of things. The other, I think, even more interesting, because there's a lot of science to this. So that's a technology solution. This next one that I'm going to talk about is more of a technological enhancement strategy for the auditory system, for the brain. So over the last 20 years, there have been lots of different strategies for helping us retrain our brain to recognize sounds more quickly and more accurately in different kinds of situations, whether it's noise, whether it's a different kind of accent. But we've really come a long way in the last year with one particular listening training program that I'm going to be instituting with in our clinic, and it's called 𝗵𝗵𝗵𝗵. So you can look it up online, and basically what it is evidence-based listening practice with the use of your laptop or your iPad, or I think you can even do it on your phone. And based on the research, so some example research would be from the University of Washington, where we know that we can actually retrain our brain to recognize different sounds, like the sound of S versus SH more accurately with practice, or we can train our brain to focus on words instead of noise more accurately with practice. That's where all of this kind of training comes from, and it's specifically for auditory, for listening practice. Because again, remember, we hear with our ears, but if it's been a long time since our brain has been hearing these sounds, we might be using hearing aids, but we might not be getting the most benefit out of them because our brain doesn't know quite how to use that information that well. Think about learning a language. When you're immersed in a language, you learn it more thoroughly. You get a better accent. You can recognize sounds more quickly. It's almost like a light switch turns on once you become fluent. So it's kind of the same thing. When you have hearing loss that's been untreated for a number of years, your brain gets a little bit slower at recognizing those sounds. So yes, the hearing aids will provide the sounds to the brain, but we sometimes, in some cases, can use a little bit of practice and training and retraining to recognize sounds and for our brain to know what to do with it. So that's one really exciting area of research in our field that I wanted to share with all of you today. Some other helpful hearing accessories. So yes, hearing aids might help you, microphones might help you. listening training might help you. But there are other things that are devices, technology. Some of these are very inexpensive that might help you. And so this is a case where it's important that you get thorough care so that you don't get the same solution as every other person that's gone into that clinic before you, so that the people who are talking to you understand what you're looking for. So I'm going to give you an example. I had a patient who was in his probably late 30s. He came to me several years ago, and he had actually a deaf ear. He was born with a deaf ear, and then he had one ear that was normal. Yes, there are technological solutions that are pretty complex, where he would wear a microphone on his deaf ear. It would send sounds to his good ear so that he could hear what's going on his deaf side. He said to me, that's not what I care about. As the audiologist, or hearing care professional, a lot of times he would say, well, that's what you need. But if we practice what we call patient-centered care, which is what we do in our clinic, we will look at what you need, what your perceptions are of your daily hearing challenges. And he told me that his hearing loss was ruining his life. That's what he said to me, quote unquote. So then I, of course, asked him the question, why is it ruining your life, and how is it ruining your life? If I just made the assumption that it was because he couldn't hear on his deaf side, I would have made the wrong recommendation. He said, well, I travel a lot for work, and I end up sleeping on my good ear, and so I cannot hear my alarm clock. And because of that, I don't sleep at all at night. I can barely, get any rest because I'm so worried that I'm going to miss my alarm clock and miss all of my meetings. So in that case, it was very interesting. I said, well, I have a solution for you, and it's probably will cost you under $30. And so what we looked at was together was the Deaf and Hear Alberta website. And we found him a shake awake alarm clock that clipped to his pillow and vibrated, so that it didn't matter which ear he was sleeping on, the vibration would wake him up. So I guess it's just important, again, to reiterate, if you have challenges with your hearing, or you have someone that you care about who has challenges with their hearing, please ensure that they get thorough care. So they're, the right questions are going to be asked of them so that we can provide the proper solutions that are actually going to make a difference to them. Just getting briefly into how much do all of these types of devices cost. Hearing aids are expensive because they are computers. You can certainly order hearing aids from the back of a magazine, I think for about $50. Well, you can imagine what kind of sound quality you would get from that. You can also imagine what kind of level of computing you would get from that. So, you generally get what you pay for, I would say, with hearing aids, and they are an investment. You're going to wear them every day, all day. They last about 5 years or so if you take good care of them. So they're anywhere from about $2,000 and up per device. Now, there is some funding in Alberta for individuals who are over age 65. It is income-based, but everyone gets some funding. Style, so how the hearing aid looks, does not dictate how much the hearing aid costs. It's the computer that's inside, and it's the ability for us to make adjustments to it, and how much, I guess you would call it, artificial learning is happening in that hearing aid, how much automatic work it can do for you, for example. Those little microphone systems, they're called FM systems. They're anywhere from about $500 and up. There's different ones for different situations. I use one, for example, where I clip on my microphone when my son and I, so I wear hearing aids. I have hearing loss, like I mentioned. When my son and I go biking, he wears a little microphone because, of course, his back is facing me and he's at a distance from me, and then I can hear him talking while we're on our bicycles. So I have one of those. It works really well for that. Different devices like telephone devices, alerting devices are, several $100s. A great resource for that is the Deaf and Hear Alberta Association. So that also is on my previous slide. You can refer to that, and they can help guide you as to what they recommend for you, depending on how much hearing loss you have and what you're looking to achieve. For seniors who are on a very low income, so for example, if they're in a long-term care facility, in some cases, the government programs and then some other programs will cover nearly the entire, if not all of the cost of hearing aids for them. And we at our clinic, we're very detail-oriented, so we'll help people apply for these programs and determine if they're eligible, more importantly. Okay, so what are some things that you can do to ensure the best lifelong hearing for you, to ensure that if these scientific advancements come along, in 5 years, in 7 years, in 10 years, and you have hearing loss at that time, and you would love to get an injection in your ear to regrow your hair cells, that you are a candidate then. You want to consider treatment when recommended. So if you have hearing loss now, we need to ensure that your auditory part of your brain stays alive, doesn't atrophy, and stays active. And how do we do that? We do that with different types of devices, whether it's hearing aids, whether it's microphones, etc. If you're already a hearing aid user, keep your hearing and your listening skills up, even if you're at home alone. Please, please, please wear your hearing aids all day, every day, even if you're at home alone, okay? It's the equivalent to learning a language. You have to be immersed in it, right? If we want our brain to understand sounds properly, it has to be immersed in those sounds, and it can only do that if you're wearing the hearing aids that you have, okay? Adaptation of hearing aids. So this is really interesting. When we have patients who come to us who've had hearing aids, maybe from somewhere else, and they've gotten off track, or they weren't very successful with hearing aids in the past, if I ask them if they wore their hearing aids every day, all day for 3 months, they generally say no. Why do you ask? It's because it takes at least that time for your brain to acclimatize to the sounds of the hearing aids. In fact, it can take up to 1.5 years for your brain to acclimatize to the sounds of the hearing aids. So just be sure that you're wearing any hearing aids that you have consistently. If you can't wear them consistently, we need to figure out why. So there's almost always a solution to why you can't wear them consistently. So please reach out to your hearing care provider, reach out to us. Even if we're not your hearing care provider, we can certainly help get you back on track. For everyone, whether you have hearing aids or not, listening to sounds is important. Listen to music, listen to podcasts, speak on the phone with your grandkids. Talk to each grandkid. They have different voices. That's good practice. Have conversations with people, watch movies, watch, on your iPad, watch cooking shows, there's all sorts of stuff on YouTube these days that you should be listening to. We're not having as many in-person interactions. So fortunately, technology can offer us other listening opportunities. So make sure that you take advantage of that. How do you get thorough hearing care? Like I mentioned, there's a couple things that that are critical. If you're going to take the time to go get a hearing test, be sure that that clinic is up to date with their testing, not just doing a free screening. So the general screening test battery that is done at a clinic was designed in about 1945. We had great researchers and scientists back then, but we've had lots of advancements since then. And so if the clinic that you're going to isn't doing those types of things, it might be time to look for another clinic. Make sure they're offering the latest technology, not just hearing aids. Any clinic that's worth going to should be offering other things. They should be doing like other testing. They should be doing word testing, listening testing. They should know about online listening programs and apps and microphone systems. They should be well versed in hearing protection. If they are, then you're probably in good hands. And at our clinics, for example, so if you're interested in having a thorough assessment, you can self-book. You don't need to go to a physician to have an evaluation. The evaluation is $65, and that does include a report that either you can have or we can also send it to your physician. This is often covered. If you have any kind of special health benefits, you can often submit it and it would be covered just like an eye exam. If not, you can certainly use that fee for your income tax for next year. And anyone that's on one of the very low income seniors programs, you can talk to us and we can reduce that fee to help you. I like to say when I do these things to think of me as your resource for hearing health. We're always going to be at the forefront of this. I have my PhD in auditory science. I run clinics. We now actually have 4 clinics. We opened one in Carstairs as well. So I know what's going on in hearing healthcare. And if you have questions or you need a second opinion or you want to know, something that could help your mom, for example, reach out to us. We're happy to be that resource. I think it's my mission to share information with people, and I think it's my reason for doing what I do. Hearing evaluation should be more than just a screening. We know that. Our team is definitely at the leading edge of hearing health and technology. And we learn from our patients. We learn from doing things like this. So definitely, if you have questions, I'm more than happy to answer questions now, but you can reach out by email as well. My email will be at the end here. Here are our locations. So we're located at Glenbrook Plaza, Mission, Mount Royal West, Carstairs, and we have mobile services also. If you can't get to us because of mobility issues or challenges with transportations, we can go to you safely. One great thing to do if you like this kind of information is to sign up for our educational newsletter. I send it out, not more than once every about 3 weeks. It has a little video that will teach you a little trick or tip or a new bit of exciting information about hearing health. You can also go to our YouTube channel. We've got lots of videos on there, and you can go to our website for more, for more information and education about hearing health.
Great information. Thank you, Dr. Scarff. I would suggest that I highly recommend people reach out to some of these contacts. I would like to get to a few questions here before we need to wrap up. Maddie says a friend uses Q-tips every day and wears earphones listening to entertainment a lot, earbuds to listen to TV several hours a day. Are they causing hearing problems with all of this?
Okay, sorry, I was reading one question, so I missed the second part of the question, but the first part was about Q-tips.
Yes, so she says, friend, yeah, we've got questions in both Q&A and chat.
Yes, okay, gotcha.
Chat, Mady has suggested that a friend uses Q-tips every day, wears earphones and earbuds quite a bit. Are they causing themselves problems by doing
that? So as an audiologist or any kind of hearing care provider, we don't suggest using Q-tips. It's not because it's going to cause hearing loss. It's because it can do physical damage to your ear canal or actually cause a perforation in your eardrum. So it's more of the medical side of things. If you have earwax, the best strategy is to just use a little bit of warm water from, after you have a shower or a bath, or when you're in the shower or bath, get a little bit into your ear. And then when you come out of the shower or bath, use a dry Kleenex around your finger and just put that into your ear as far as your finger goes. That's a safe distance in your ear. If you have more wax than that, then you can use ear drops, a combination of hydrogen peroxide and water, 50-50, lukewarm, put a few drops in your ear with an eyedropper, keep your ear up for about 5 minutes. And then you can go into the shower and try to get some water out. If you want, I have a handout. So if anyone wants the handout, you can reach out to me by email and I can email you the handout, and it tells you the do's and don'ts of taking care of ear health in terms of earwax.
Bev, I'm not entirely certain of whether it's a question or whether you're advising. Try to get the AVA app help. You mean you need help to get the AVA app, or you have used it and it has helped? Maybe you could clarify that for us. And Tom wants to know, what is the cost of the cross system for unilateral deafness?
Mm-hmm. So the cross system is, it's two things. It's a microphone that then sends sound over to a hearing aid. So it would be the cost of one hearing aid depending on the level of technology you get. So anywhere from $2,000 and up. And then the transmitter is generally around $2,000 also.
And Maureen, thanks for joining us again. Fantastic presentation. It seems to me there is real resistance on the part of many people to even get a hearing test. I believe part of this is because of the cost you mentioned. However, I think there's still also a feeling of embarrassment to have to wear hearing aids. How can this reluctance be overcome?
Okay, so that's a great question. So, I've done a lot of research into why people are reluctant to get a hearing test and certainly to take action. But there's a lot of psychology to it in addition to costs. And this is an interesting point. In the UK, where hearing aids are covered, they have the same uptake rate of hearing aids. So covered financially, like the health system would cover hearing aids there. So it's not just the cost. In fact, there's a lot more to resistance than just the cost. And by the way, there are hearing aids for every single person's budget. Okay, there's different programs that we can get you help with. There's, you know, we offer different things like paying over several months, all sorts of different things. We even are very creative. If you can only invest in one hearing aid at the time, but you really need two, we show you how to use one hearing aid for both ears. I won't go into detail, but it's a really creative way of maximizing your budget. So there's something for everyone's budget. But it's not just about budget, it's more psychological. So I think education is the key. Everyone's at a different point in acceptance of the fact that they might have hearing loss. Sending someone to get a hearing test at a place where they're not going to have high pressure would be important. And maybe sharing information about, you know, the brain and how hearing loss, if we leave it for more than 4.5 years, we're putting ourselves at risk. So we really want to minimize those risks if we can.
Overcome the vanity and the stigma. And Bev has clarified here that it seems she can't get the AVA app. So
okay,
it might be something that she could reach out to you
absolutely. Yep,
directly.
absolutely.
And Bev, and
then
Dr. Scarff can put you in touch there. Anonymous has asked, I've been tested twice, but now overdue for a follow-up. Took my tests at a clinic at the Children's Hospital. Does it still exist? Do I need a referral to go back? My doctor never heard of it and thinks I have to go to a private company.
Yeah, so I used to work at the old Children's Hospital. That's it's where they have the adults audiology program. I'm not sure that it's open right now because of COVID. So even when it was open prior to COVID, it would take about 6 to 12 months to get a test there, just because they have limited numbers of just limited resources. So yes, it still does exist. Your doctor can refer you, and then there would be no fee. But I know for a fact, because I used to work there, they don't do listening and noise training, and they don't do the they actually don't provide any kind of suggestions to improve the hearing. They simply do the diagnostic test.
So again, perhaps reach out to you and you can put them in the right direction as far as
absolutely
being able to get that
yeah.
Additional testing. Will this presentation be available to view again? Yes, Janet, we are recording, and once we've had it converted and up on our Kerby Centre YouTube channel, we'll be sending that link out to you so that you can follow up and revisit again if you wish. Gina, is AL being incorporated into, or AI being, is AI being incorporated into hearing devices, and if so, how?
Yeah, that's a great question. So yes, AI is already incorporated into advanced hearing aids. So basically what happens is when the hearing aid recognizes that it's in a certain situation, it will make automatic adjustments. So that's kind of basic AI, but the newer hearing aids start to learn and make changes more quickly and make changes when they know that you're in certain locations, actually. So yes, it is being incorporated into hearing aids.
All right, well, thank you very much, Dr. Scarff. Some great information there. And as I said, if anyone else has any further questions, I would highly encourage you to reach out to Dr. Scarff. If you didn't get the contacts, feel free to reach out to me. And again, we will get the information out to you as soon as we can, once we have that YouTube video. So thank you all very much.
Thanks so much, Colleen. Thanks, everyone.